Well, it's time now for our In Focus Health Report. Health reporter Lino Mudu joins us now with an update on mental health. Lino.
Hello, Vincent. The Kenyan healthcare system has virtually no provision for caring for the mental ill. The government spends only a small fraction of 1% of its health budget on mental health. And there is only one psychiatrist for every 5 million people outside of Nairobi. Cathy Majtenyi has more on this report.
It's World Mental Health Day here at Mathari Hospital, Kenya's main psychiatric referral facility. Watching the festivities from the sidelines are some of the patients, who tell me living conditions are appalling.
When we defecate, we step on our feces. There's no tissue. We use this. We can't hide it. We use magazine or we use this.
Not only are the conditions unsanitary, they are also overcrowded.
There are 15 beds with people, we're about 20, 25. Some is to sleep two together, two on the same bed, with the blankets and just few. Okay? Some of them sleep on the floor, and then there are fleas, so many fleas we don't.
Minister of Medical Services Anyang Nyong'o tells VOA his government has plans to revamp Mathari Hospital.
It started as a rehabilitative center, really, in colonial Kenya. And it was seen mainly as a facility where you take prisoners who have mental problems. You don't need to go to prison, and they were brought here. But we think now we need to think in modern ways and make this a proper mental health facility.
But he says money is the main hurdle to improving Mathari Hospital and the healthcare system.
It's only about 5% of the budget. And as you know that, I've always said that that is really, really not enough. We need to have a much more imaginative way of financing healthcare in this country.
There are few alternatives to government health facilities, such as the private Kamili organization. The volunteer staff offers free treatment at 2 outreach clinics in Nairobi to about 2,000 people. Community health worker Salome Gaido says clients come from all across Kenya.
Some of them come from very low backgrounds, some very poor, some deprived of their capability of working because of the illnesses that they are suffering from, and some who are very educated, employably suffered along the way, and not given that chance to prove of their potential.
Kenyans living with mental illnesses are stigmatized, seen as having been cursed or having done something wrong. Teacher Andrew Kuria Kimondo is a former patient of Mathari Hospital, receiving outpatient treatment now. He says his family and some medical staff view him as a criminal and drug addict.
You cannot force somebody to love you. You just stay the way they want. But in yourself, you know, you are not a criminal. You do not contribute to it. You are sick like any other person.
A lesson he lives every day of his life. Cathy Majtenyi for VOA News, Nairobi.